Hi everyone, I'm Dr. Wilson from Brightside Dental. Today we have Dr. Paul Yao over here from Eagle Eye Aesthetics and Surgery.
Hi guys.
So he's here today to let us pick his brain about aesthetic stuff, and because we are all very interested in aesthetic practitioners, we hope we can learn some cool tricks and what he does.
Yeah, and likewise as well, because again, dentistry is something that I'm not too familiar with, so also have a lot of questions to ask and find out more as well. Teeth whitening is a huge thing, right? So one question that I have as well, is it the same for everyone? And like, is there a difference between the home kits that we get sent home with, or like you buy from like Watsons and all that, versus what you guys do?
The main differences are the ingredients that are involved. In Singapore at least, the main ingredient of teeth whitening, hydrogen peroxide, can only be administered by dentists. Whatever you can get over the counter is not going to be hydrogen peroxide. It's probably some other chemical that we have no control over. Applying it yourself, first thing is going to be a bit iffy because you don't know what you're actually applying on your teeth.
And it doesn't really fit all the time, right? Like
yes,
once they can
correct, because those are like just heat molded to your teeth.
Yeah.
Whenever you just apply the gel, it tends to spill all over your gum. We have patients that actually come to us and they complain. They say, oh, I bought some products online or on Taobao or whatever, and I end up burning my gums. Like my gums turn red after a while. It gets very irritated. When we do professional whitening, we actually protect your gums. We apply a gum barrier. The gum barrier makes sure that the gel doesn't spill over to your gums. It only stays on the teeth. And because we are using a high concentration of hydrogen peroxide, within one session, we can actually see the results.
Hydrogen peroxide, is that right to say that it's something that you will try the first line for teeth whitening? Is that fair to say? Or?
Yes, it's the only chemical that is proven to have whitening effects on the teeth.
Oh, okay.
And you need a fairly high concentration. So you can find products with like less than 0.1% hydrogen peroxide that you can probably get online, but it's not going to be very effective.
Right.
Yeah.
Then is one session usually enough, or do you need more than one session for that? And how long are the sessions usually?
Over here, our sessions last about 1 to 1.5 hours.
Oh wow, okay.
It's inclusive of check, clean your teeth before we do the whitening. And usually one session is enough to see significant results. But of course, if you are talking about teeth that have been stained over decades, quite yellow, and drink coffee every day, then maybe you may require a second session in order to achieve a whiter result.
Okay, fair enough. And then once we do stuff like that, or even veneers, because now the teeth are whiter, they look better, how do we care for it, or do we not need to care for it?
Oh, of course, you still have to do your regular dental checkups. Everyone should be doing their dental checkups at least every 6 months. Of course, your own oral hygiene at home is very important because you want to maintain your teeth color, right, after you have spent the effort to get it.
Yep.
And also, in terms of diet and your lifestyle, we try not to eat too much foods or drinks that are staining so that you maintain the whiteness of your teeth.
Then what happens if, say, you have another cavity that pops out after you have like veneers done?
Oh.
Is that treatable, or is it you have to just pluck out the whole tooth?
Of course not. Depending on the size of the cavity, you can actually do a filling just right beside the veneer. But if the cavity is very big, then we may have to convert, say, to a full crown or something like that. But of course, as much as we can, we will always try to save the tooth and not extract it fully.
Okay, fair enough, yeah. And then you mentioned something earlier as well about ingredients that you can get for whitening for dentists versus beauty practitioners. Yes. Is there any other reasons why you might not recommend going to a beauty practitioner for whitening or your veneers?
Okay, so yeah, the two main things that beauticians like to advertise about their services: teeth whitening and veneers, usually composite veneers. So we'll start on whitening first. Yep. Just now, for teeth whitening, only licensed dental clinics are allowed to use hydrogen peroxide of effective concentration. And in order to do that, we actually have to do a protection of the gums and make sure that the teeth are healthy, the gums are healthy before we do the whitening work. So that's one thing about the safety and also about the effectiveness of the whitening. As for veneers, it's vastly different. Okay, so what you get at aesthetic clinic or beautician clinics is that basically what they're doing is slapping a layer of filling on top of your tooth.
Yeah, okay, so they're just like pasting it on.
Yes, your tooth might not even be clean to begin with. They're just adding a layer on. So what ends up is you have a very bulky tooth. It's just going to be very unnatural and very thick. The worst thing is that because it's an added layer on top of your tooth, it hinders your ability to brush properly. And sometimes your teeth may even be fused together and you can't even floss. So what we see here quite often at Brightside is patients coming after they have done these veneers at the beautician clinics, coming to remove them because they realize that their gums are getting so red and inflamed every time they brush.
Oh, that sounds quite painful. Are
Correct.
they easy to remove though for those, or is it?
It's a very torturous process because when we remove the fake, we call them fake veneers, sorry, we do not want to scratch your underlying tooth at all. Correct. So even though we use a drill, we are doing it in like a 3-4 hour process to slowly remove it one by one, such that we preserve everything that you still have underneath, and there's no damage to your original teeth. Just do it properly the first time.
There's some that go overseas, the tooth gets shaved down to those very thin pegs, and then they won't name names. But those thin pegs one, is that the way that you do it?
I think some of these are done by dentists.
Yep.
But in order to do it so fast, they actually do trim your teeth down much smaller than is required. In fact, most of them are actually doing full crowns on top of natural, healthy teeth. In the process, you end up losing a lot of healthy tooth structure, which will mean that these teeth are severely weakened and they may break down much more easily over time. Whereas strictly tailored and customized veneers usually will not require you to remove so much teeth structure, usually about 0.3, 0.5 mm, and is seamlessly adapted to your tooth so that you can clean it well, you can maintain it, it can last you a lifetime.
Yeah, the only reason I ask about that is because a lot of my patients as well, they ask me about going to different countries to do some of the aesthetic procedures, or like you mentioned, some of the beauticians, they actually bring the post in and say, can you do the same thing?
Yeah.
I will admit, some of them, they actually do good work as well. I can see the fillers done, they look perfect. But I think, like what Dr. Wilson has mentioned, a few things that we do take into notice is that one, in Singapore at least, whatever you get at a licensed medical practitioner, be it an aesthetic physician or dentist, you can be assured that the products that we use are all licensed, HSA approved. There's safety and everything. We're using original products, that there's no ambiguity about it. And we do, based on what our training is, the safest way that is available for you. And if complications happen, we try and avoid it in the first place.
Accountability.
Yeah, the accountability is there.
That's why I always say it's better to just do it properly the first time.
Correct.
It's always easier than to try to repair something that has been damaged in the first place.
And then overseas one, I think I would say that you really have to do your own research. That one we can't advise. I had a patient of mine, she actually went to KL for a work trip, and she went to a very reputable clinic, and the clinic actually was a very good one. And she just had a bit of a complication with a filler that was done. So she was a nose filler, and then she started to have a little bit of complication. So the vessels were, I think, being compressed, which means it's purple and some pustules were forming. So those are warning signs that we need to get rid of the filler immediately so that the blood supply to the nose can return. Otherwise, it'll be compromised, infection and things can set in. The problem was she got it done on the last day of a trip to KL. And then when she flew back to Singapore, the next day she woke up, this happened. So she rushed straight down, she did the right thing, and we started to dissolve the filler for her. The clinic that she was with was actually very responsive and offered to do the full service recovery and everything. But I guess the thing was that she couldn't go back to them because it's all the way back in KL. So unless she was willing to fly back up, which would waste more time, the next best thing is that she had to look for someone else to do it. So the problem with that is, I guess
she found you.
Yeah, but I guess it would be something, if we were the ones that were injecting or fixing the teeth, we would know exactly what we did, how much we did. It would be a lot easier to recover.
Exactly, yeah.
For her, we had just had to spam everything, and she was lucky also because her clinic that she did it with, reputable and good service recovery, offered to take care of the charges and all that.
I have a lot of friends that ask me, there are very differences between Caucasian and Asian teeth. What about for skin? Is there a difference, and should we be looking after our skin differently from our European or Caucasian counterparts?
To answer that question, there are definitely some differences, especially where we are in terms of our location in the world itself, Singapore, and the amount of sunlight exposure that we get. So aside from genetics, which is one thing, Asians, we are quite prone to pigmentation disorders such as melasma, where you get this very blotchy sort of pigmentation that forms on your cheeks, and they are actually one of the harder pigmentation disorders to treat. And sometimes I can't even promise patients that I clear it off 100%. I can only promise that we try our best to lighten, and that's about it. Even though there's a genetic component for that, one of the things that actually triggers and makes this a lot worse, and especially where we are in Singapore, is sun damage. So for sure, because we're in somewhere that is 24 hours, 365 days a year, we get so much sunlight. Sun protection is something that for my Asian patients and actually for anyone that's in Singapore here that I advocate quite a lot of. We don't really have the breaks that the other countries do, like the temperate ones where you get winter and then it gets dark out a bit earlier. And,
Summer all around.
and sun exposure, sun damage is one of the leading causes for all the signs of aging. Your fine lines that come out, the dehydration that comes out, and pigmentation disorder, it weakens your skin barrier, and just by being in the sun, it's hot, you perspire, you're more likely to get clogged pores and all that comes along with it. So one thing is we really got to find good sunscreen and a good cleanser to actually help mitigate those risks for us that are living here. Thanks guys, thanks for having me.
Thank you for coming down. It's our pleasure to have you here.
Appreciate it. Look out for more videos in future.